All right. Welcome to our second annual World Birth Defect Day Facebook Live event. World Birth Defect Day is a time to spread the word about preventing birth defects, and organizations who support birth defects, research, and resources for family affected by birth defects. I'm Robert Felix, past president of MotherToBaby, and this year we're going to be talking specifically about COVID-19 and pregnancy and breastfeeding, with a special emphasis on questions surrounding the COVID-19 vaccine. I'm here with Dr. Sonia Rasmussen, who is a world-renowned pediatrician and epidemiologist. She's published some pretty important papers giving us insight about COVID-19 vaccine and pregnancy. She's part of our MotherToBaby organization. She has served as the president of our sister society, the Society for Birth Defects Research and Prevention, and has worked closely with many groups also supporting the World Birth Defect Day, like the Center for Disease Control and Prevention. We also have two of our MotherToBaby experts who co-chair the Emerging Issues Task Force, which currently focuses on COVID-19. We have Lori Harris-Garibay from our affiliate in North Carolina, and Kirsty Parada from our affiliate here in California. Ladies, thanks for joining us. Before we dive into questions and answers from our expert panel about COVID-19 and pregnancy and breastfeeding, I want to take a moment to say hello to those who have joined us. We have Nicole, Jenny, there's Nancy, gosh, there's a lot more, but I think I'm going to go ahead and proceed and start with this. So we'll be taking questions from you live. If you have questions about COVID-19 vaccine and pregnancy or breastfeeding, go ahead and start asking them in the comment box. But before I do that, I do want to thank our other organizations, in addition to MotherToBaby, who support this special event, who are part of the planning for the World Birth Defect Day event. And those include, and these are just some, there's a number of them, Center for Disease Control and Prevention, March of Dimes, the International Clearinghouse for Birth Defect Surveillance and Research. There's ECLAMSI, which is a program of clinical and epidemiological investigation of developmental congenital anomalies in Latin American hospital births. Whoa, that's long. ISEMSI, a collaborative study of congenital malformations in Spain. Fundación Mil, Society for Birth Defects Research and Prevention. The National Birth Defect Prevention Network. Food Fortification Initiative. Center for Spina Bifida Prevention, and of course there's a lot more. So, but let's go ahead and get started with the question. So let me see here, what do we have? This is a good one. I think it's one, of course, the more common ones that we get at MotherToBaby. And it's from Nicole. Are there risks of getting the COVID-19 vaccine during my pregnancy? Who wants to take a stab at that? Dr. Rasmussen.
Yeah, I can start with just talking a little bit about the vaccines that are available. It's exciting news that there are already 3 different types of vaccines that are available. And I know you've been hearing a lot about on the news about these. The first one that became available was from a company named Pfizer. The second one was from a company named Moderna. And then just this past week, the emergency use authorization was given by the FDA for the Johnson & Johnson vaccine. The first 2 are what are called mRNA or messenger RNA vaccines. The third one is a viral vector vaccine. They work in different ways, but actually in a lot of similar ways. They really are a way of getting a little piece of genetic material into your deltoid muscle and into the cell, and so that it can make what looks like the spike protein, not the whole virus, just a little tiny bit of the virus that the body can respond to. So when you see COVID-19 in the future, your body can respond to it. So even though, you hear about mRNA or messenger RNA, you hear about the viral vector, this adenovirus vector, they're just ways to get it into your muscle, into your cell, and so your cell can then make that antigen for your body to respond to, so that when you see COVID-19 in the future, your body can attack it and get rid of it quickly. People have had a lot of concerns about, this technology came up so quickly, they were approved so fast. these are vaccines. Actually, the mRNA technology was worked on for about 20 years. The viral vector technology actually has been in the works for more than 50 years. So these are things that have been around, have been used in other types of vaccines in the past, and they have been shown in the past year for COVID-19 to be safe. And the great news is very effective.
And like Robert said, we get a lot of questions about these at MotherToBaby about, possible risk of getting the vaccine during pregnancy. And the reason it's so tricky to answer at this point is because, like Sonia was mentioning, these are new vaccines, so we really just don't have pregnancy data available yet. The good news is that all three that are currently available in the US are not live vaccines, which is typically the type that we avoid in pregnancy. We also know that the Johnson & Johnson vaccine uses the viral vector technology, which has actually been used before for Ebola. So different vaccine, but same technology. And during those outbreaks, pregnant women were immunized with that vaccine and no adverse effects were seen. So that's somewhat reassuring. We're also, of course, collecting data as we speak. So hopefully we're going to have more information, more answers to these questions sooner rather than later. All three of the vaccine manufacturers are continuing to monitor people who are in the clinical trials who do become pregnant. And I believe Pfizer specifically is conducting a trial with pregnant women, enrolling them to further evaluate safety. And then we also have, of course, studies like we do here at MotherToBaby, the prospective observational research studies, which are looking to gather more data as well. So hopefully time will give us more information about this question. But the bottom line right now is because, like I said, the vaccines are just starting to be studied in pregnancy, the information is still pretty limited. However, based on what we know about these and other vaccines, most experts do not believe the vaccine would increase the chance of birth defects or other pregnancy complications. And CDC currently says that, people who are pregnant can choose to get the vaccine if they're part of a group that's eligible to be vaccinated.
And Robert, anytime that we look at taking a vaccine or taking a medication in pregnancy, it really comes down to weighing risks and benefits. And it's true that there's not a lot of research about the vaccines specifically in pregnancy yet, but a year into the pandemic, we do have quite a bit of information about the risks of COVID-19 illness in pregnancy. And that research has shown that people who are pregnant have a higher chance of severe illness if they do get sick with COVID-19. This is compared to people who are not pregnant. And so even though that overall risk is quite small, we have seen that there's a higher chance of being put in ICU, a higher chance of needing to be put on a ventilator, and even a slightly higher chance of death. We're also seeing a higher chance of preterm delivery among people who have COVID-19 as compared to the pregnant population overall. And whether these preterm deliveries are happening on their own as a result of the virus or the mother's symptoms, or if the pregnancies are being induced early, is not entirely clear. But regardless of the reason, we are consistently seeing greater rates of preterm deliveries among women who have severe COVID-19 during pregnancy. So, when we look at the risks of illness, it really does make sense to try to reduce those risks as much as possible. And we can do that by getting a vaccine that is effective in preventing severe illness. But, for a lot of women, it's not as clear cut. They might still have some reservations. So when looking at your own specific risks and benefits, some things to consider might be, what is your own chance of coming into contact with the virus? And you can think that your job and your other duties, do those put you at a greater risk of coming into contact with someone who might have the virus? Do you live with someone who might have a greater chance of coming into contact with the virus? What is the spread of the virus like in your community at this time? And how able are you to practice preventive measures like wearing a mask and social distancing and staying away from crowds? And then another consideration would be, if you do get sick with COVID-19, what are your individual risk factors for severe illness? We already know that pregnancy can increase the chance of severe illness. Do you also have underlying health conditions like diabetes, high blood pressure, sickle cell disease, heart conditions, lung disease, kidney disease? All of these things can add an additional layer of risk on top of the risks that we're already seeing with pregnancy. And we've also seen that people of color, especially Black and Latino women, appear to be disproportionately affected by severe illness from COVID-19. So sort of getting a picture of what your own risk factors look like, that can help guide your decision and how important it might be that you get a vaccine to help reduce those risk factors. It's sort of weighing the known risks of the infection against the unknown and really unexpected risks of the vaccine.
Great, very good. You know, you mentioned earlier about reservation, and I think you'll all agree that at least 50% of pregnancies are unplanned, or people don't, and then they don't know that they're pregnant till maybe the end of the first trimester. So and this is actually a question that just came in from Jesse at Food Fortification Initiative, you know, and I think it's great, and we get that. You know, if someone got the first COVID vaccine, then they find out they're pregnant, then they're, you know, they're not sure. And so should she move forward with getting the second round, the vaccine? You know, what do you do? What are your thoughts?
Yeah, the American College of Obstetricians and Gynecologists has clearly recommended that you go ahead and get that second dose as scheduled if a second dose is required. And there's nothing in the CDC recommendations that would discourage getting the second vaccine as scheduled. Note that the new Johnson & Johnson vaccine requires only one dose for right now.
Okay. Anybody would like to add anything more to that?
Maybe important just to point out that, you know, we're celebrating World Birth Defects Day, but at this point, you know, we haven't seen any indication that the vaccine or the disease, as far as we know, would increase the risk for birth defects. So although we're talking about COVID and COVID-19 vaccine today, we don't see anything that suggests a risk for birth defects, which I know can be kind of one of the main questions women have when they have to get vaccinated in the first trimester, since that's such a critical time for organ development to take place.
Thank you for pointing that out. I mean, that's true, because when I've been out doing talks, that's one of the things that they ask. In comparison to the last epidemic problem we were talking about with Zika, you know, that was kind of alarming. And with this, in a way, it's reassuring that we haven't really seen, quote, a pattern of birth defects. So we have a question here from the National Birth Defect Prevention Network. And the question is that they've heard mixed reviews about the vaccine and its effects for one brand versus another. Is one brand of vaccine better to get during pregnancy? What do you think?
That's a great question. So at this time, the Advisory Committee on Immunization Practices, or ACIP, states that there's no preference for one vaccine over the other in pregnancy. So if you're part of a group that's eligible for vaccination, the current recommendation is to go ahead and get whatever vaccine is available to you, because that's going to be able to provide you with the most protection.
Mm-hmm.
Yeah, and I think people are saying, well, I want the good ones. I want the ones that give 95% protection versus the one that gives looks like about 72% protection in the United States. I think it's really important to remember that these vaccines weren't compared at the same time and place. So the studies were done at different places, and they were done at a very different time during the pandemic. And you're certainly hearing now that the pandemic, we were very concerned about these variants. And some of the variants are not covered as well by the vaccine. And so it may be that there's really no true difference between these vaccines. It may be that they were just tested at a different time. So my recommendation to people is to get the vaccine that you can get. If you're offered the Pfizer vaccine, get it. If you're offered the Moderna vaccine, if you're offered J&J, the Johnson & Johnson, get that one. So I don't think it's time to be saying, well, this one I'm sure is better than the other, because I don't think we have data right now to say that one is better than the other.
Right. So you talk about efficacy, but I think one of the issues now that people are talking about, even though that is in the back of their mind, is, all right, if it's efficacious, but then I hear about side effects, you know. So that's perhaps something that might also have them ask, well, which one should I select that has less side effects? And that's actually a question that just was posed by Lizette. Is there one that has might be better or less side effects? Do you think? I mean, again, I know they weren't all studied and compared the same way, but I mean, you hear a mixed bag of reactions. Is there some trend that you're seeing, maybe a preference with less side effects?
Yeah, they all have some degree of reactogenicity, which reactogenicity is really your body saying, I'm responding to this antigen
Right.
so that it's ready for when it sees COVID-19 for real in the future. So I don't see reactogenicity as a bad thing. You can have some soreness in your arm. You can have sometimes a fever. You can have kind of flu-like symptoms. It seems like most people, I've had both vaccines. I had a little achy feeling the first day, and the second dose, I had a little bit more of an achy feeling, but it wasn't something that a little Tylenol didn't take care of. So that is something that I think is important for pregnant women, in particular if you have a fever and in the first trimester, it's important to try to avoid fevers in the first trimester. Of course, you can get a fever from having COVID-19 too, but right. I think we know that fevers can increase the risk of certain types of birth defects. And so it's important, if you do get a fever with that vaccine, to take some Tylenol and get your fever down.
So these side effects are pretty similar to what you might see or get when you have other vaccines that we've had in childhood. So, okay. So here's Robert, the question. Yes.
I wanted to say the reality is people at this point probably are not going to have a choice about which vaccine to get.
Right.
And they're all fairly equally effective at preventing severe disease from COVID-19 and hospitalization from COVID-19. So really the best vaccine for you is the one that is available to you.
Yeah, and I think people I think people overlook that, and they are so concerned about I understand, but still, you gotta have to put your focus on what it's supposed to do. So here's a question from Jenny, and it's about breastfeeding. So what about breastfeeding? Can you get COVID-19 vaccine if you're still pumping and or breastfeeding? What are your thoughts?
I can take this one. So again, it's pretty similar to what I was talking about with pregnancy, because all three of these are such new vaccines. We just don't really have a ton of great data looking at their use in breastfeeding women. However, it's pretty rare that we see a vaccine being contraindicated in lactation. And again, many of the professional organizations have come out with pretty reassuring statements about getting these vaccines while breastfeeding. For example, the Academy of Breastfeeding Medicine says that people who are breastfeeding do not need to postpone or stop breastfeeding after they get the COVID-19 vaccine. So that's definitely reassuring to see. And again, CDC is kind of leaving it up to the mom to make the decision. So again, saying if she's part of a group that is recommended to be vaccinated, she can choose to do so.
Okay. Any other thoughts?
Yeah, we don't really expect this to result in an exposure for a breastfeeding infant. The vaccine is given in the muscle, and that's really where the immune response starts to build. And then the components of the vaccine itself break down very quickly in the body, and it's not expected that those components would enter your bloodstream or make their way into the breast tissue or enter the breast milk at all. And if some of those particles did happen to enter the breast milk and were swallowed by the baby, those would be destroyed in the baby's stomach. They would be digested basically instead of becoming systemic in the baby. So we don't expect it to have any harmful side effects on a breastfeeding infant if a mom were to choose to be vaccinated while she was breastfeeding.
All right. So before we go on, again, if you're joining us, our live discussion, MotherToBaby and organizations around the world, including the CDC, March of Dimes, the Society for Birth Defect Research and Prevention, the National Birth Defect Prevention Network, and many others are recognizing World Birth Defects Day today. We are commemorating by taking questions from the public about COVID-19 and the vaccine during pregnancy and breastfeeding. And so if you have questions, please send it to in the comments, and we'll try to get to it as soon as we can. So next question, and this is from Irma, and it actually is about the vaccine. And COVID-19 vaccine seems to have come out so fast. How can we trust we know enough about it to know it's safe? And you
Yeah,
might
I
have
think
said it a
Sonia,
little bit earlier too.
yeah, Sonia touched on this some earlier.
Yeah.
And just to reiterate that, yes, these vaccines were made available quickly because of the urgency from the pandemic, but the science behind these vaccines is not new at all. It's been studied and put into practice in laboratory settings and with other types of clinical trials for decades. It's been used looking at other vaccines and even for cancer treatments. So improvements in that technology over time meant that now we really had an opportunity to put this technology into practice with the COVID-19 vaccines. And in fact, the vector vaccine technology is already being used in vaccines against Ebola, and we haven't seen any red flags or safety signals with the use of those vaccines during pregnancy.
Okay.
The other important thing is that none of the steps that are normally gone through to approve a vaccine were skipped. So every one of the steps, some of the steps, people say, well, how could it usually take several years and this time it took less than a year? And some of it is money. There was a lot of money, a lot of federal dollars, a lot of taxpayer dollars was used because we realized how serious this pandemic was. And that made it so that you could move these vaccines through the clinical trial process, get lots and lots of people. So these clinical trials all had tens of thousands of people in them. For example, the Johnson & Johnson that was just approved a couple days ago had about 40,000 people. And with the clinical trial, you have half those people get the vaccine, half the people get a placebo, they get a saline shot, and people don't know which they got. And then they are followed up to see if they develop COVID-19 or not. And what those studies showed is that people who got the COVID-19 vaccine were much less likely to get COVID-19. People were much less likely, really none of the people that got the vaccine had very severe illness or death. So really showed these to be protective. The other thing is the approval process was similar to other vaccines. So it wasn't like we took any shortcuts, that the United States government took any shortcuts. And in fact, some vaccines that have been approved in other countries are taking a longer time here because the bar has been set so high by the Food and Drug Administration and the CDC to make sure that those vaccines are safe before they are put into the arms of people in the U.S.
All right, so here's a question. I think it's going back to the previous related to the previous question, and actually it's from Israel. It's from Siham at actually a teratology information center. And so she says 2 days ago they had a call from a nursing woman who took the 2 doses of Pfizer vaccine, and after both doses she and her baby had hives. She's pretty sure that the vaccine is not absorbed and will not affect the baby, but could it be the other ingredients that entered the milk and caused the hives? And I think that was the issue with the vaccine and the formulation, but not necessarily the mRNA. So can you comment on that?
I think that it would be unlikely that that would be the cause of the hives. And, hives are so general that there's a lot of things that can cause hives. It seems like the mom and the baby wouldn't have had hives at exactly the same time if the mom had gotten the vaccine and time to get through the milk and to the baby. And I wonder if the hives were caused by something else. Of course, it'll be hard to ever know for sure. Some people do have allergic reactions to these vaccines, more often to the second one than to the first. I haven't certainly heard of anything of it passing through breast milk, though. But Lori, or have you guys heard of anything like that?
Yeah, I haven't heard of anything.
I would just add, I think you said this question came in from Israel, but here in the U.S. we have the V-Safe program. So after you get the vaccine, if you do have any adverse side effects, you can always report it. I believe it's an app. So that way, of course, if we notice this starting to happen a lot, then it can be looked into further and researched more.
Okay. So
yeah, the CDC does encourage people to register through the V-Safe app. It's a smartphone-based tool, and it allows you to report any side effects that you might have, and it also gives you a reminder when you're due for your second dose. And that's super easy. The app will walk you right through. You just go to vsafe.cdc.gov and it will walk you right through it.
That's fantastic. Okay, I was going to ask you a question, but another one came related to, I guess, breastfeeding. So this is from Amy Barker. Will the vaccine give antibodies to the baby as well if mom gets a vaccine during pregnancy? Do we know that, or is that known yet?
I don't think we know the answer to that yet. We certainly know that there's good news in that when women get other vaccines during pregnancy, that those antibodies can pass across the placenta. For example, the flu vaccine or the Tdap vaccine, if mom gets those during pregnancy, she can pass those to the baby so the baby is protected after birth. We don't have that information right now for COVID-19 vaccines.
Okay.
We hope that that's the case.
Right.
But we certainly don't have that information right now.
Right. All right. So this is actually coming in from the CDC. So the question is, CDC recently started a COVID-19 vaccine pregnancy registry. Can you help explain to viewers what the pregnancy registries or studies are and why they might consider taking part in one? Are there additional ones looking at COVID-19 vaccine and pregnancy?
Yeah, I can take this one. So pregnancy registries or studies are, of course, so important. I've been talking all day about how we don't have pregnancy data, we don't have lactation data, and so this is how we gather data to learn more about the effects of these vaccines. So I know here at MotherToBaby, we've already launched a nationwide pregnancy registry for both COVID-19 infection in pregnancy and COVID-19 vaccine during pregnancy, which is going to help us gather more data. Looking at things like, does the disease or the vaccine increase the risk for miscarriage, birth defects, pregnancy complications, long-term effects? We're kind of looking at everything. And we've had a lot of interest so far, which is great because the more women that enroll, the more data we're able to collect. So if anyone is interested in getting involved with that study, it's a fairly straightforward process, a couple interviews over the phone during pregnancy. Sometimes they'll ask for medical records to verify information, and then following up after delivery to get information about the baby, of course. So if you're interested in learning more, you can go to our website, which is MotherToBaby.org. You can also call us, chat with us, text us, and we'd be happy to chat with you about that specific registry.
Okay. Yeah, so the other day I took a call, and the question I think relates to breastfeeding, and I think that's one of the things that MotherToBaby is looking at is if a woman was vaccinated during the pregnancy and the baby's been born and she's now breastfeeding, what do we know? And I think that's one of the things that they're looking at in MotherToBaby, so that'd be interesting. All right, let me see if I have any. Hold on. All right, that's it in terms of a question. So that's actually all the time we have for this live World Birth Defect Day discussion. I want to thank my colleagues, Sonia, Lori, Kirsty, for joining me to answer all the great questions you asked today. I also want to thank all the organizations supporting this live broadcast and partnering with us for World Birth Defect Day. And again, there are a number of them, but ones that come to mind include the CDC, March of Dimes, the International Clearinghouse for Birth Defect Surveillance and Research, ECLAMC, EMC, Fundación Mil, Society for Birth Defects Research and Prevention, the National Birth Defect Prevention Network, Food Fortification Initiative, Center for Spinal Bifida Prevention, and again, there's many, many more. I am Robert Felix, and if you have any other questions, please reach out to MotherToBaby. There are many ways you can get in contact with our free service. All of them are listed on our website, MotherToBaby.org, including on how you can chat live with an expert. And believe it or not, two of our chatters are on the panel today. And our pregnancy studies provide crucial medication safety info so moms and providers can make better treatment decisions. On our website, we also have an information on how to get involved in our studies if you're pregnant or a healthcare provider in North America. We'd also like to encourage you to get involved with some of the World Birth Defect Day partner organizations in whichever country you're joining us from. Many of them also have valuable resources about birth defect research. and prevention. For that information, please visit worldbirthdefectsday.org. So once again, thanks for joining us.